Good evening, everyone. It is 7 o'clock. We will go ahead and get started. Welcome to the Yale New Haven Hospital Women's Services Virtual Town Hall. We are really very pleased to be offering our second town hall. For those of you that do or do not know, we did host a town hall 2 weeks ago, and it proved to be very successful. We received many questions and a really engaged group of patients and families. And so we really made the decision that we wanted to host a second event where we would follow up on some of the questions that we were unable to answer on the last town hall. So my name is Katie Donahue. I'm the Executive Director of Women's Services here at Yale New Haven Hospital, overseeing both women's and neonatal ICU services. So welcome to all of you, and we look forward to having a really great and very question-filled event tonight. I will go ahead and introduce the rest of the team to you. We have joining us tonight, we've invited some new members so that we could really answer some of those questions that we were unable to get to on the last round. So we have Dr. Matt Bizzaro is our medical director of our neonatal intensive care unit. We have Dr. Elena Aragona. She's our medical director for our well newborn unit. We have Dr. Catherine Campbell, our medical director for labor and birth and maternal special care. We have Dr. Steve Fleischman, who is our Associate Chief of Obstetrics and Gynecology for Yale New Haven Hospital. We have Dr. Jessica Aluzzi, Medical Director of Obstetrics and Midwifery for Yale New Haven Hospital, Vidone Birthing Center. We have Laura Sundstrom. Laura is a midwife with our practice, the Women's Health Associates. And then we have Dr. Chris Petker. He's our Chief of Obstetrics and Associate Chief Quality Officer for Yale Medicine and Yale New Haven Hospital. All right, so the way we will go ahead, we're going to run through a few slides. We did have a presentation at our last event. We have modified that a touch. We will go through the slides, offer some initial information that seem to be a recurrent theme so that we can try to answer a number of questions right off the bat for you. We've also taken some of the questions that have already been submitted and tried to incorporate those into the slides as well. We will then work throughout the presentation to evaluate questions that are coming in live. We'll do our best to try to answer those, and we will also run through the questions that we've received over the past 2 days. So we hope this is a beneficial event, and we will go ahead and get started.
Hi, good evening, everyone. My name is Chris Petker, and I'm the Chief of Obstetrics and the Associate Chief Quality Officer. And we wanted to start by helping everybody learn what to expect when you're expecting during the COVID-19 crisis and what things will be like when you come to the hospital. And so we're going to run through a few slides. We gave a little bit longer presentation last time. So on Facebook Live, that's archived, and we'd be happy to share that with you if you wanted the longer introduction. Next slide, Nelson. So unless you've been diagnosed with COVID during your pregnancy, which is actually turning out to be very rare in Southern Connecticut, this is what you'll see when you come in. This is the normal labor and birth experience that our patients encounter when they come to the hospital. And what we want to try to get across to people is that this is for 98% of the women coming for childbirth at Yale New Haven Hospital. This is what they're seeing when they first come in. Next slide, Nelson. People will have questions during their pregnancy about or have concerns about COVID. Even if they end up being that 98%, there might be questions about an illness they have or how would they get tested. And we did want people to know that their healthcare providers, their midwives and obstetricians, are very well equipped to answer these questions. They can order tests. They can do the things to prepare you for coming to the hospital. But we also have the health system in Yale New Haven Hospital. We also have a call line, a call center to answer your questions. We have healthcare professionals that can evaluate you if you think you might have an illness like COVID. And we also just have people that answer questions about the logistics of the hospital, and whatever you might have. So this number 833-ASK-YNHH has been really helpful. We get about 1,000 calls a day to this number. And you should feel free to call this line, although you can call your obstetrician and midwife directly for questions. They're definitely able to handle these questions. Next slide. What we want to convey is that things are overall very safe in Southern Connecticut and very safe at Yale New Haven Hospital, particularly for women that are presenting for birth, to give birth. So this slide demonstrates how COVID has affected the population of women coming to give birth at the Yale New Haven hospitals. So the big blue circle is basically all of the women that we've tested in the last month for basically all of April. And it shows that all of the women that we've tested coming for childbirth, and we'll get to our testing protocol in a second, but we're testing all women presenting for childbirth. 96% of them do not have COVID when they come to give birth. A small percentage have symptoms when they come to give birth. That's about 1%. And then there's a small percent as well, about 3%, who don't have symptoms that we test. And 1 or 2 hours into their childbirth experience, it turns out we find out that they're positive after testing them when they get admitted. That's as opposed to the New York experience, which I think has made the press to a degree that's created a significant alarm around the United States and particularly Southern Connecticut. The New York City experience is on the right, where about 15% of the women presenting for childbirth at a New York City hospital are COVID positive. So we have a fraction of these cases coming to our hospital. So your chances of having COVID when you come in to give birth are extraordinarily small, 96% chance that you're going to have a normal birth experience. Next slide. But because COVID is a very serious illness, and because patient safety and the safety of our healthcare workers is a priority, and keeping the hospital safe is a priority, we do have some things that we've done at the hospital to try to maintain that safe environment. And we just wanted to run through these 6 things with you. First off, we're screening all patients and visitors for fever and symptoms when they arrive. So a basic question that all patients and visitors get when they arrive to the hospital. We're also testing all patients who present for childbirth. And we're doing this with a test of a swab of the nasopharynx that goes for PCR testing. And it's the most advanced and most sensitive, best performing test that's available in the United States. That test, we get back the results in about 2 to 4 hours, depending on the situation. And we're able to tell you and your family that you don't have COVID and you're going to have a normal birth experience, or that you might have COVID and we might change your birth experience a little bit, and we'll get to that in a second. Another thing that we've done to keep things safe is we've limited our visitation. We do have one support person that can come with you and be with you for your childbirth. That person is wearing a mask during your experience. Fourth, we have a specialized unit called the Obstetric Comprehensive Care Unit, which Dr. Campbell will talk about on the next slide, where we're keeping our patients who are diagnosed with COVID, and they're having their birth experience in this unit. And they're doing their recovery there, their postpartum care there, and we're keeping their babies over there. So we have a separate unit where we're taking care of our patients who are affected by COVID. Fifth, we're doing staff screening and very deliberate staff screening. Temperatures are checked twice a day. All staff are wearing masks. And all the staff know that if they don't feel well, they're not supposed to come to the hospital. And we have replacement for them to keep things safe for you. And then finally, we've joined our services. We've combined our birth and our newborn services from both of our campus. The Vadome Birth Center at St. Raphael's has joined us at the York Street campus. So we have one campus now. And that allows us to combine our resources. It also allows us to have our obstetric comprehensive care unit. And it's created one big family at the York Street campus to help take care of you. Next slide.
Great, thanks, Chris. So just to highlight about the OCCU, or the Obstetric Comprehensive Care Unit, we talked about it at our last town hall, but we have several things in place to help keep our patients and their families safe when they come in for childbirth. So if you've been exposed to someone with COVID, or if you have symptoms of COVID infection, then we recommend that you call prior to coming to the hospital. When you come to the hospital, you'll be met by one of our staff and you'll be brought up to our labor floor. If you have COVID positive, or if you need to be screened for COVID, that will happen. And if you are admitted for labor, or if you need to be evaluated, we'll have you come to our OCCU for further care. We will have you and your partner wear masks, and this is true for all women and their partners coming into the hospital. And then in the OCCU, we have lots of special adaptations to help care for you during an admission to the hospital or during childbirth. The universal testing helps us evaluate all women coming in for their childbirth experience. And if you test positive, you would come to the OCCU for your anticipated labor and delivery. A labor support person can be with you, and this can be someone that you've been living with. So even if they've been exposed to COVID, they can be your labor support person. However, we do screen all visitors coming into the hospital, and so that person would have to be healthy and asymptomatic from any symptoms of infection. We rely on video technology for a lot of the interactions, just to help minimize people coming in and out of the rooms. The delivery team that would normally care for you on the regular labor floor will still be caring for you in the OCCU. And then last time we met at the town hall, we talked about the CDC recommendation for separation of the newborn. And we spent a lot of time talking about this. I'm sure some questions will come up. We do echo the CDC's recommendation for separation, but this is a shared decision-making conversation with you and your primary provider, and even your pediatrician if you want to involve them in the conversation. And just to reassure everyone, no one would ever separate your baby from you at birth if it's not something that you chose to do. So this is a decision that you make along with your healthcare provider. We support breastfeeding, and if it needs to be breast pumping and milk expression at the beginning while you're recovering from COVID, we'll help you do that, and then help get you ready for discharge home with your newborn. Next slide.
So I think Dr. Aluzzi, you're going to speak to this slide.
Thanks, I was on mute. Yes, I'm really pleased to talk about our perinatal education program. The instructors who teach childbirth classes and newborn care, breastfeeding care are still teaching those classes, and you are able to register for them online on our website. They're also offering maternity tours via Zoom, so that those of you who have not yet been able to come and visit the unit will be able to have an electronic tour of the unit, and you can become a little more familiar with the place that you would be giving birth. Seeing the rooms with the tubs and the regular rooms can be, really reassuring to kind of, so you can visualize where you're going to be while you're in labor. I'll also mention the electronic education classes. So these are classes that you can do at any point of the day or week. They're electronic, they're online, and they're very high quality. They're fantastic ways to learn more about labor and birth, how to cope, breastfeeding, newborn care, and cesarean birth. So I really encourage everyone to take a look at this website, and if you're interested in engaging in any of these activities, to give the site a call or to go online to register for these classes. We can do the next slide now. So this is a labor and birth room. And as you can see on the right-hand side, there is a tub available in this room for water immersion to help provide some more comfort and hydrotherapy during labor. All of the rooms have either tubs or showers, and many women find this very comforting during the early parts of labor. And then as you can see, the rooms are very spacious. There's room to move about within the room. And there's room for your support person to also relax and be there with you. The next slide. Should I turn this over to Katie now?
I think it's over to me, right?
Dr.
Thank
Fleischman,
you.
go ahead.
All right.
Yes.
Welcome, everyone. So I'm Steve Fleischman. I'm the Associate Chief of the Department of OBGYN at Yale. And first and foremost, on behalf of the over 100 OBGYNs and midwives who provide care and the staff at Yale New Haven, congratulations. We're excited for you. We want this to be a wonderful experience, and we hope that your birth experience is everything you wanted it to be, despite the pandemic that we're going through now. We know there's a lot of changes that have happened in the office structure and how we approach you when you first get there. But once you're with us on labor and delivery, we hope that this is an experience that you remember and cherish forever. And we are really excited for you. This is a picture of our maternity and newborn unit, which is our postpartum care area. In terms of sort of things on the postpartum that came up on our call last time that I just wanted to discuss. First is we are doing circumcisions. There's a lot of questions last time about whether we were going to do circumcisions or not. Is there elective procedures? We do proceed with circumcisions in the hospital. You do not need to come back and do them later. We do them as a necessary part of your care. And the other thing that I just wanted to discuss was the length of stay. So many people have heard that hospitals don't want you here or you have to leave faster. And we want you to know that this decision is something that you discuss with your physician or midwife who's caring for you. We are happy to provide you with resources to have you leave early if you'd prefer. But we are not in any rush to get any of you out of the hospital. We want you to have whatever support you need, whether it's meeting with our lactation consultants, whether it's spending a little more time getting care for yourself or for your baby. Our goal is, again, to give you the experience that you are looking for. And if that means you want to go home a little early, we're happy to support you in that. And if it means you need to stay for the full duration, we're happy to have you stay. But that really is something that we're discussing with you, and we come up with those decisions together. And I think next slide.
All right, perfect. Thank you, Dr. Fleischman. I think, as we're going to go ahead, we'll get started. We're going to start to answer a few questions. There's a few questions that have come up just while we've been talking, and I think since we're right on this topic, we'll go ahead and address these. Maybe Dr. Pecker, do you mind just talking about the results and what the process is while waiting for results?
Yeah, thank you. So when patients come in and the decision is made to be admitted, they get their nasal swab and that's sent to the laboratory. This is generally done in their labor room. When they get admitted, they will be taken to their labor room and the test will be done there, because in most cases, we're presuming that the test will be negative because there's a 97% chance that it's going to be negative. So we have the patient in her laboring room during that time, and if it needs to change, then we change it after that. But it's very rare that that comes up. So we keep people in their labor rooms and we treat them as a normal laboring patient as long as we can. Staff will be wearing masks in the meantime. If the patient happens to deliver before the results are back, we might take extra precautions with what we wear or how we handle things during the delivery, but we will treat the baby normally at the time of birth as well. The people taking care of the baby might be wearing more than they usually wear, though, to the birth.
And Dr. Pecker, are partners being tested?
Thank you. We're not testing partners at this time. We don't think that that's enough of a risk to test partners. If partners are symptomatic, we try to help them before they come into the hospital so that they can get tested and treated. But asymptomatic partners generally no, but we are having them wear masks during the visit.
All right, great, thank you. The other question I think maybe we can touch base on here is regarding doulas. So maybe Dr. Campbell, do you mind just responding to the question about whether or not we'll be changing our policy related to doulas?
Sure. So, I think all of us want everything to get back to normal as soon as possible. So right now, we do allow the one labor support person for our patient who's coming in for childbirth. We will continue to reevaluate the environment transmissions in the state of Connecticut, so that when we reopen things and allow additional labor support persons, we will make sure that our community of women planning childbirth are the first to know.
Thank you.
Yeah.
While we're on the topic of doulas, Laura, do you mind just speaking a little bit about just the current process with doulas? What are some of the things we're doing here at Yale New Haven to support our patients and be creative during this time?
Sure. So families, I want to remind you, with all the changes, there's one thing that's really staying consistent for all of us, and that is giving birth. It's the same work, the amazing stuff you're going to do. It's going to be the same thing. We're going to be happy to be there with you for it. And so remember that this process is a physiologic process, and it's going to go along just as you've planned it to. And we're looking forward to doing that with you. There's things that are different, as you've heard, and one of them I think is hard for all of us is not having extra labor support people in the unit and not having doulas there with us. I want to remind you how accustomed we have become to operating on Zoom and electronically, and how this has become, oddly enough, a very comfortable and normal way for us to communicate and connect to one another. And it's no different for connecting with your doula or your mom or your sister or that other person who you would hope to have with you. I think if you were to show your doula, for example, that photo that we showed you of the labor room, she would probably be able to tell you that's room 459, and let me tell you, we're the best position to get in to feel comfortable in the tub. So having that person who you're connected to via FaceTime or Zoom for hours if you want it is really still going to be a very meaningful connection. So don't forget about that part of it. And then also our biggest resources, our nurses and the rest of the staff at the hospital are going to be wonderful support for you, whatever birth that you're seeking. If you want to be in the tub, on the ball, if you're choosing an epidural, they're going to be your advocates for helping this process go in the way that's right for you. So even if that team, as you imagined, is a little different, you're not going to be lacking the support and the advocates for the birth that you're looking for.
Great, thank you so much. All right, we're going to go ahead and we're going to pivot now to some of the questions that had come up previously about the well babies. And so as babies are born, what are some of the changes and or policies that you might experience? And so there were a lot of questions about how things would be handled. So we're going to go ahead and begin with Dr. Aragona and ask that you answer the question, will my baby receive newborn vaccinations?
Hi, thanks for having me. And yes, you can rest assured that your baby will receive routine newborn care during their stay, which does include newborn prophylaxis and all vaccinations.
Great. I'm gonna actually pass a few questions right off to you, so sit tight. Also, is there a safe protocol in place for exiting the hospital with the baby?
Sure. So the process for exiting the hospital with your newborn is similar to before the pandemic. But you should know that everyone in the hospital the staff is universally wearing masks, and there's only a very limited number of visitors allowed in the hospital at all of whom are being screened for COVID symptoms and contacts. So the exit from the hospital should be nice and safe for you and your baby.
And then do you recommend parents bringing home a newborn what do you recommend? So what are your recommendations for parents to keep their baby safe, essentially? And so when they go home, what are some of the practices that they should put in place following discharge?
Sure. Our recommendations on discharge, again, aren't very different from the general CDC and Connecticut recommendations for everyone, actually. So we recommend that families stay home and stay safe. We recommend that people only leave the house when necessary, like for OB and pediatrician appointments. And if there's another adult at home besides the mom, ideally that adult is the one to leave the house for necessary errands, like going to get groceries. And those errands should be as infrequent and as short as possible. Right now, we're recommending that there's no visitors at home during the COVID-19 pandemic, and we're encouraging everyone to use technology like FaceTime to stay in touch with their families. And as always, we recommend that families practice good hand hygiene to keep everyone at home safe.
Great, thank you. And then can you just speak to when families would meet the pediatrician for the first time following delivery?
Sure. So everyone should know that a pediatrician rounds on and examines all newborns in the hospital within the first 24 hours of birth. And when the baby is discharged from the hospital, we're recommending that the follow-up with the pediatrician outpatient is as usual. Generally, that's within 1 to 3 days. And we encourage everyone to reach out to their intended pediatrician or the pediatric group to see whether or not they'll be using any technology like a telephone or telehealth visit for that first one.
Great, thank you so much. All right, so Dr. Bizzarro, we're going to shift to you for a moment. There are some questions related to visitation in the NICU. Can families visit their baby or babies in the NICU?
So visitation policies in the NICU have changed somewhat, but families can absolutely still visit their babies in the NICU. So I assume we're talking about moms that have tested positive and significant others haven't screened positive and their babies in the NICU. So in that situation, one family member at a time is allowed to visit at the bedside. And visitation hours have not in any way been restricted. And both mom and the partner may visit as well. We just ask that there's one at a time at the bedside on any given day.
Okay, thank you.
Instead of criteria, if mom has tested positive, then visitation is restricted.
For just the mom or for both family members?
Well, if the mom has tested positive and the partner has been in direct contact with the mom, then there's a restriction on visitation for a duration of time, usually about 14 days from the onset of symptoms or the positive test. And that policy is different in the NICU because we're dealing with a very medically fragile patient population, as you might imagine, the majority of which have underlying respiratory disease. So concerns regarding spread of the SARS-CoV-2 virus around the NICU are incredibly, worrisome. So we're a little bit more restrictive in that setting.
And in that scenario, could the family assign another visitor to visit the baby?
Absolutely. The current policy says that the visitors have to be either the mother or the significant other. If it's a scenario like I've described, then we would absolutely make an exception to that rule and allow others to visit.
All right, great. Let's see. Given the World Health Organization and CDC recommendations and the studies coming out of New York, with limited evidence that babies are high risk for getting sick from COVID-19, what is the justification for the policy of separating asymptomatic mothers who test positive for COVID-19?
This is a really good question. And it is absolutely true, thankfully, that babies appear to be very low risk for acquiring the virus and for getting sick from the virus. However, they're not no risk. So we're part of a registry from the American Academy of Pediatrics, and what we're seeing is about 5 to 10% of newborns, so babies within the first month of life, are testing positive. The good thing is that the majority of those babies are either asymptomatic or have mild forms of disease, but there are cases of babies having fairly severe disease, requiring hospital care units and time spent on ventilators. So the population is not immune to acquiring virus. The issue with an asymptomatic mom who tests positive is also a very insightful question. What we don't know is where in that disease process that asymptomatic mom might be. We know that people who are in the early stages of infection may be asymptomatic but have a high risk of transmissibility of that virus, and their symptoms may come on a day or two later, versus someone who's asymptomatic because they have mild disease, or someone who's asymptomatic because they're in the recovery phase of their disease. It's really difficult to tell at the time of labor, and we are certainly erring on the side of safety and caution by undertaking that policy. But as was mentioned early on, this is a case-by-case discussion regarding separation in each particular scenario, and things that factor in do include the clinical condition of the mom and the infant.
All right, great, thank you. And there just was an inquiry as to whether or not Yale has treated any newborns that have been tested positive for COVID-19.
So the good news is that we've, both in the neonatal intensive care unit and on the well newborn side, we've tested a fair number of babies and have not had a single positive. I also am in contact with medical directors of the neonatal ICUs throughout the Yale New Haven health system, which includes Greenwich Hospital, Lawrence Memorial Hospital, and Bridgeport Hospital, as well as some of the medical directors in other units throughout the state. And we have yet to have a baby test positive, which is great. I think a lot of that has to do with a lot of the precautions that we've been taking and that have been outlined early in this discussion around the time of delivery, because although we don't think that this virus is being transmitted prior to birth, we're fairly certain that the babies can acquire this virus after delivery, sometimes even in the delivery room. And I think that part of the evidence that that Chris laid out early with low rates in our obstetric population, as well as what we're seeing in the newborn population, has to do with some of the precautions that we've undertaken.
Great, thank you. Dr. Aragona, I believe you did address a bit some of this question, which was what's your recommendation for who should visit once discharged? And so can you just reiterate, I know that you spoke to really there should be no visitors, but there's this continued question seeking, like, for how long do you have to continue this, this practice?
Sure. Yes, I would reiterate, like you just said, that we're recommending no visitors to the family during this time period. And I would do that as long as you can right now, echoing what Dr. Bizzarro just said, that the population, the newborn, is high risk. And again, we're doing the best that we can and to protect the baby. So yes, no visitors during this time. Please use your technology to speak with grandparents, family, however hard it might be.
All right, great, thank you. All right, Dr. Fleischman, can we just do a follow-up with you related to capacity? I know that you were speaking to the maternity newborn unit, but there are some questions related to the consolidation of services to one campus, and also the fear that possibly there's cohorting of patients and the risk of COVID in that circumstance.
So we have all private rooms. When you come to the labor floor, every room is private on the labor floor. In the triage area, they're all private. When you vacate a room, those rooms are cleaned and made sure ready for the next patient. So you're never cohabitating with any patients on the labor floor. And our postpartum unit also is all private rooms. And because of the sort of merger of the Dome Birth Center and the St. Raphael and the York Street campus, when we built out the OCCU, which is our obstetric complex care unit, we also built out another floor, which gives us some additional capacity for postpartum patients and patients who may be undelivered and need space. So we are not doubling. We make that a priority, and we want you to have a great experience. And we know that that's not something people want to do.
All right, thank you. Dr. Campbell, do you mind speaking to if I am positive for COVID, will my unborn baby catch it? And how will it affect my baby?
Sure. So the good news is we have not found any evidence that COVID is transmitting from mom to the baby during pregnancy. We're still in the early stages of this pandemic and really learning a lot about COVID, but all of the evidence so far shows that that's a low risk time for transmission.
And there are a number of questions coming through related to the baby and whether or not we test the baby. Can you and/or Dr. Aragona speak to when the baby is tested and what that process looks like if they're tested at all?
Sure. So in moms who have COVID, their baby is tested with the same swab that adults and kids have at 24 hours of life. And these are just in moms who test positive for COVID.
All right, great, thank you. All right, another topic, but we are going to, again, group our answers here. There are a lot of questions related to breastfeeding. Dr. Aragona, I know that some of these came through, so you know what is on the docket for some of these, but the questions are related to bringing in breast pumps. Are you able to get a breast pump at the hospital? Are lactation services available? So do you mind trying to give a little summary of the breastfeeding support here and what patients should do?
Sure. So no, you don't need to bring your own breast pump to the hospital. We have hospital-grade breast pumps available at the hospital. And we also have on-site breast pump coordinators available 7 days a week who can meet with the mom, verify insurance, demo breast pump options, and then provide you with a personal use insurance-covered breast pump for you to bring home with you. In terms of lactation, our lactation consultants are available in-house 7 days a week. They're still working with our moms who need any additional support or guidance. We have in-person visits, and then the lactation consultants also have some telehealth options available depending on whatever the mom should need.
And Katie, the same is in the neonatal intensive care unit with all the you just mentioned, breast pump, availability, and lactation services.
And then can either of you speak to, there's individuals asking if they are pumping milk and they have more than necessary, is there somewhere to store the milk for the baby?
In the neonatal intensive care unit, we have a milk room. So moms that are expressing milk deliver that milk to our milk room where it is stored. Extra milk gets frozen in our milk room. Fresh milk gets dispensed right to the bedside. All of our neonatal intensive care unit rooms have individual breast milk refrigerators.
Sure, and on the nursery, pumped breast milk can be stored in a refrigerator in our newborn procedure room.
Perfect. And then breast milk, questions about whether or not it, does it contain antibodies and will it help my baby not contract COVID?
I can start with that one. Breast milk is best and does provide a lot of protection to your baby. It protects against a lot of illnesses and it's a wonderful source of nutrition. When you become sick with a virus, you develop antibodies to fight that virus. And when breastfeeding, the antibodies are conveyed through the milk to help protect your baby. I can't necessarily speak directly about COVID-19 protection though.
Yeah.
It really would depend on the timing of acquisition of the virus. This is a novel virus for those of us that are seeing it, and as a result, we don't have pre-existing antibodies like we do for a lot of other illnesses, which is what makes breast milk so beneficial to neonates. So women that acquire the virus around the time of delivery, it's highly unlikely that there's going to be enough antibody response at that time to get past to the newborn. If you've had the virus, a few months ago, and now we're pregnant and delivering, there's more of a possibility.
And then maybe Dr. Campbell, can you respond to, for COVID positive patients and the practices of breastfeeding, are you allowing moms to breastfeed their baby?
Right, so again, this would be a shared decision with you, your obstetrician, your pediatrician. So the recommendation from the CDC that we also echo is that you would either breast pump your milk or hand express it and then have a healthy caregiver feed your baby that express breast milk. Again, this is going to be a longer conversation with you, your provider, and your pediatrician.
And there's another important point to bring up now, Katie, that's come up as a question in the past, which is we right now have no conclusive evidence that the SARS-CoV-2 virus gets passed through breast milk either. So there's no concerns at the present time that you can transmit the virus if you have it to your baby through breast milk. That's being studied, but the data right now point against that possibility of transmission, which is reassuring.
All right, great, thank you.
Right, and I guess I'll just make one other point is that, yeah, right, so we agree with that, and really the risk is that close contact is really the risk of passing the infection because we think that it's coming from the nose and mouth and the breathing and that close contact.
Thank you for that. All right, so now we're going to jump over to some operation questions. Dr. Pecker, I have an easy one for you. When do you think things will be back to normal?
Oh, that's the hardest one, I think, of all of them. I wish I could say when things are going to be back to normal. There are a lot of different models out there, and some predict things will get worse in the fall, and some predict that things will die out slowly. And it's really hard for us to predict. I do think that things will have changed from before and after all of this. And I do think that healthcare workers will be wearing more masks around the hospital and more clinical encounters. I do think that we'll screen people differently when they're coming to the office and to the hospital. I think that healthcare workers won't work with the sniffles anymore. I think that we'll be much more cautious about that. So I think that things will be a lot safer after all of this, eventually when we're through it all. I'm hoping that during the summer months, during June, July, things will be a lot more normal and we'll be a lot less preoccupied with this. We might still have some of the same habits of wearing masks and testing. So I'm hoping that it's this summer, but really it's a lot of what our community will be doing. If we continue to do the social distancing and these good practices of following the directions of our governor and our healthcare providers, it will hopefully be a good summer.
Great, thank you. All right, Dr. Aluzzi, we have a question from someone who was due to give birth in July, and they were supposed to be delivering at the Vidone Birth Center with the midwives. Where and with whom can I expect to give birth now? And do you see this changing in the next couple of months?
Well, the good news is that the Vidone Birth Center providers, all of the midwives and the physicians and the nurses are now all together at the York Street campus. So when you go into labor and come in to the new campus, we'll all be there waiting for you. We've had a really nice number of births already at the York Street campus, and I think that they've been as beautiful as they were at the Vidone Birthing Center. So I want to provide you a lot of reassurance that we are all there using the same philosophy of care that we applied at the Vidone Birthing Center. As far as the question goes about how long we will be there or where will we be in July, I think that there's a lot of unknown right now. Just as Dr. Pecker was saying, you know, we really don't know how long we're going to need to maintain the OCCU for COVID positive patients. And that's really going to help us decide and the hospital decide when and if we can move back to the other campus. You know, the fall is coming, and if there's a lot more virus in the community again, we may still need the COVID unit. So what I can assure you is that our team is going to remain together, and you can still receive the care that you're receiving prenatally and during your birth from the team that you've been seeing all along. The other thing I would mention is that we are having Meet the Midwives tours that are on that website that I showed you before, so that for those of you who haven't gotten to meet all the midwives in person, this is another way to kind of meet the group and become familiar with some of the other faces on our team. Thanks.
Great, thank you. Dr. Fleischman, we have a question about a patient's asking if they're ever going to be able to have an in-person visit with their OBGYN to hear their baby's heartbeat again and make sure everything is okay.
So the answer is absolutely they should. I think most practices are open. In fact, I think almost every practice in the community in this area has almost all their offices operational as of Monday. We are still working on limited schedules, so there is an attempt to space visits out to be safer, but no one is spacing out visits any further than some practices around the country do on a normal basis when the COVID doesn't exist. So I'm not sure why you haven't had a visit. I don't know how early in pregnancy you are, but by all means, you should 100% be having an in-person visit. You should be able to have hear your baby. And if you're worried at all and you've been told to wait a little longer for a visit, I reach out to your provider, talk to your midwife, talk to your physician, call your practice and let them know that you'd like to come in. I don't think any of us would ever tell a patient they couldn't come in if they wanted to come in for a visit. So reach out and make the call, and I guarantee you they'll see you.
And can I add just a little bit there? I think that we've all been very thoughtful about this. The midwives, physicians, and nursing team have all gotten together to look at the spacing of our visits and how often people really need to come in to assure a healthy pregnancy. So it may feel a little bit different to you now than it was in a different pregnancy outside of the COVID era. But please, as Dr. Fleischman said, please give us a call if you're feeling anxious and need to hear your baby. I'm sure we can make space for you to come in.
Great, thank you both. There is a question related to the process for scheduled cesarean sections. So maybe Dr. Luzzi, do you want to just speak to that question? What happens when someone needs to come in for a C-section?
So there is a process that we've set up so that women can come in either the day before or 2 days before to be seen. A couple of things happen during that visit. One, you'll be given kind of special wipes to clean your belly in preparation for surgery. That makes surgery much safer and decreases the rate of infection. The other thing that will be done is that your blood will be drawn to get your blood type and type in screen to the blood bank so that you can safely undergo surgery. And then the third thing we're doing is testing all women at that time for the COVID virus. And that's really helping this process move forward smoothly, because if you have the results before you come in for your scheduled cesarean, we can take care of you in the appropriate fashion.
Perfect, thanks so much. There is a bit more. We have 2 other buckets of operational questions that have come up. They came up in the previous town hall, and we did get a few more follow-ups this week. So we are going to jump to food and parking. So Dr. Fleischman, do you mind answering a few questions about what parking is available for patients? Is the valet service open? And where would patients then enter to come into the hospital?
Sure. When you arrive in labor, first we want you to call ahead, talk to your physician or midwife, make sure it's the appropriate time to come in. Once you're told, yes, come on down. If it is between the hours of 6 a.m. and 9 p.m., you are going to come to the Children's Hospital entrance. We still do offer valet parking 24/7. All valet parking staff have their temperatures monitored twice a day. They have hospital masks and gloves. So we're doing our best to protect your car as well as yourself. And between 6 a.m. and 9 p.m., you are going to the Children's Hospital entrance. After 9 p.m. until the following morning, you're going to the pediatric emergency room entrance, which is right next door to where the Children's Hospital entrance is. And there's valet parking there as well. If you do not feel comfortable with a valet parking person getting into your car and you're nervous about it, you can always park in the Air Rights garage, which is the big garage when you come off the highway and you're coming into New Haven. That's right next to the hospital. You can park there yourself. We do not valet. We don't valet there, and we do not validate parking there, but you are welcome to park there and then walk across the bridge and come into the main hospital entrance if you so choose.
Perfect, thank you. Dr. Campbell, I'm going to ask you 2 sets of questions related to kind of food and safety. So one question, a number of questions related to food. Maybe I'll give you the questions and you can summarize. Is the cafeteria food safe to eat? Are moms provided cleaning supplies to have to wipe down their trays before eating? And then is there food available for the support person? And then can we order food from the outside?
Okay, great. So yes, number 1, the food is safe to eat. Everyone who works inside the hospital goes through the same screening. So just like Dr. Fleischman was outlining, that all healthcare workers are screened for the COVID infection or symptoms of infection twice a day. So are those who are working in the cafeteria. So that food is safe. Same thing with the folks who are delivering your food trays to your room. You can take your standard precautions before you eat, and number one is going to be hand washing. So that 20-second hand washing prior to eating any food is going to help minimize any risk of transmission. And again, we would echo, this is not a foodborne illness. So the good news is that you're not getting it from the food that you eat. In addition to the cafeteria, the food delivery trays to your room, your labor support person and support person during your stay can also order food. And we do recommend this because it helps minimize the movement of your labor support person through the hospital and helps our hospital lower risk of transmission that it can occur. And then the last thing is, yes, you can order food from outside. That's been very popular pre-COVID, and it continues to be popular during COVID. We have lots of good restaurants in New Haven that are happy to deliver food to you. And even if you happen to be admitted to the OCCU, where movements of your partner might be a little bit more restricted, we do keep that option available to you, and the staff helping care for you can be that interim person to go down and grab the food and bring it up to you. So yes.
Great, thank you. We have a few questions about masks as well. So do I have to wear a mask during labor? And I know that someone on the live chat has asked if they can bring their own mask to wear, or do they have to wear a mask that we give them? So do you mind just speaking to masks in general? Who's wearing them and when?
Sure. So what I like to say when I'm on the labor floor is that everyone should be wearing a mask for any person-to-person conversation. And so that is true for healthcare worker to healthcare worker conversations. It's true for your care provider who's in the room with you, and any other type of interactions that can occur. So you can wear your home mask into the hospital. During your hospital stay, depending on if you're COVID positive or negative, you might have that find that a hospital mask would be more comfortable, and that would be available to you. When you're in your room and you're there with your labor support person and no other healthcare workers in the room, you can take off your mask. That's your decision. But we do ask that if a healthcare worker come into the room or someone else comes into the room, we ask that you put your mask on and that your partner wears the mask too, because we do know that when people interactions occur, if each are wearing masks, it actually significantly lowers any risk of transmission.
Great.
And then I think too, there's a question about during labor wearing a mask, and definitely during labor, we understand that having a mask on might not be possible. And that decision is going to be yours in terms of, how comfortable you feel with a mask on. And if you feel like you need to remove it during labor, definitely that is allowed. No one's going to make you wear that mask.
Great, thank you. There are a few more questions related to antibody testing. So are we doing it, and are we recommending that patients try to get that done prior to coming in for delivery?
Sure. So right now, we are not recommending antibody testing. It is still considered investigational. Obviously, there are lots of testing companies out there that have been working towards getting antibody tests. There is a lot of variability, and right now we don't know how to interpret those tests. So we do anticipate that this is the direction things will go, but it's still a work in progress. As soon as we are able to and give more information to patients with those antibody tests, we will.
Great. Thank you for that. So Dr. Petker, there are a few questions related to pregnant healthcare workers and whether or not they should stop seeing patients at 28 weeks. And do you agree with this recommendation? And then what are our current recommendations for pregnant healthcare providers and regarding in relation to potential exposures? And does this vary by trimester?
Right. So every pregnancy is different, and this should be a conversation between you and your healthcare provider to make the final determination, and also your place of work. The CDC recommends that, if possible, pregnant healthcare workers get diverted to areas where there might be lower risk, or that there are risk mitigation strategies in terms of lowering the risk to a pregnant healthcare worker. But the data that we have right now doesn't show that there's a higher risk of contracting the disease or of a complication from the disease just because of pregnancy. That's limited data right now, so we are very cautious about our recommendations. And what we would suggest is that you work with your physician or midwife and with your supervisor or the person who would work with you at work to try to find an area of work that might be a lower risk for you.
Great, thank you. Laura, I know you have spoken a little bit about the hospital and supporting natural childbirth, but there are some questions related to the general equipment and birthing balls and the process for cleaning these and coming in and out of patient rooms. Is this a safe process, and are the balls in fact being properly disinfected?
Sure. Yes, so all of the equipment that we use for each person is cleaned before it's brought into the room, before it leaves the room. So yes, all of the equipment is still available. So the squatting bar, using the tub, laboring on the ball, all of those options that we've provided are still available. And yes, they're all cleaned, as they always have been, with an even heightened sensitivity now.
Perfect, thank you. Dr. Aluzzi, do you mind speaking to nitrous oxide and whether or not we will be allowed to use this again in the future, as well as whether or not you're allowed to use FaceTime during delivery?
Sure. So our nitrous oxide machines were designed so that, when you're breathing in and out nitrous oxide, it scavenges and vacuums up the air that you're breathing out. So you might think that this is okay to use in the COVID era, but the other concern is whether the virus can actually become or is present on the machine itself. And then we move it to other people. And these machines are probably a little bit more difficult to clean. At this point, that's very theoretical. And some people have asked, now that we're testing all women and we know that women are negative during their labors based on their testing, why can't these women use the nitrous oxide? And what I can say is that that's an evolving question that our team is going to be thinking about closely. And as we are with all things that are going on right now on the labor unit and in the hospital, we have to keep evaluating the risks versus the benefits. So that's something that we do hope that we can bring back at some point. But right now, as Dr. Pecker showed with the graphs, we do have patients who are COVID positive and turning positive after screening, even without symptoms. So the next question about the FaceTime. So yes, as we mentioned before, it's a very nice way to interact with your doula at home or another family member or friend. You can use FaceTime during your labor, but what we do ask is that you don't use any type of video equipment aimed at the actual birth itself, so at the vagina. Okay, so we really prefer that these interactions occur face to face, and people can share in this moment with you. But we have always said that videotaping of the birth and of the vaginal area itself is really not allowed in the hospital.
Great, thank you. All right, so I'm just trying to quickly go through and see what some of the priority questions here might be. We talked about tubs and that tubs are in fact available. I know that Laura spoke to that. Jessica, there's a question about students and interns. Are there students and interns still present on the labor floor?
Yeah, so right now there are no students on our labor units, especially what I'm speaking about is midwifery students and medical students. There is going to be a time when we do invite these trainees back into our birth setting. And it really depends on whether or not we have enough PPE to share with those students. It is very important that medical students who are going to become obstetricians and midwives who are training to become the future midwives do still have the experiences of working with us and with you. And many patients have told us that, the midwifery student that they had during their birth was the best thing that happened, because that student, was able to bring things to the mom and stay by her side. And so, it is our hope that we'll be able to invite the students back, and the same with the medical students. We will always talk with you about that first, and we would always do it only if we thought that it was safe. I think that you're going to see, our role modeling to the students is very important to really train that next generation of OBGYNs and midwives. So I hope that you agree with me that they can actually improve the care that you receive in the hospital, and eventually we'll be able to bring them back safely.
Great, thank you so much. So we are starting to run out of time. So there's 2 more questions that I'd like to try to get through. It is 8 o'clock, so we will answer these 2 questions and then go ahead and wrap it up. But they seem like important questions that I think we should try to quickly address. The first question says, other hospitals have not discontinued the use of oxygen for women as an option if needed during labor. Why has Yale discontinued this? So Kat, can you speak to this question, Dr. Campbell?
Sure. So it's a great question. So number one, no use of oxygen has been discontinued in moms who need it for any type of respiratory need. So that's where oxygen really makes a difference. There is a practice of using oxygen, for example, maybe when the baby's heart rate goes down, that a mom would put on a face mask of oxygen. And although that practice continues, there's actually, that is not the treatment that actually helps the baby's heart rate recover. It's really position changes, maybe rolling a mom onto one side or another, or changing a position, and maybe even trying to get a contraction to stop. And so for that reason, because oxygen in this setting has not been shown to help a baby and potentially even harm the situation, we have asked that we don't use it for this particular situation. But if ever a mom needs oxygen to help her respiratory status, that is going to be one of the first interventions that we offer.
All right, great. Thank you so much for that. That was very helpful. And then the final question is, are non-stress tests necessary for a healthy pregnancy that is closer to 40 weeks? Dr. Campbell, can you answer this one as well?
Sure. So in an otherwise uncomplicated pregnancy, we would not recommend a non-stress test. Once you go past your due date, the risk of stillbirth can go up. And so for that reason, that is standard and continues to be standard, that we start to do some fetal non-stress testing and assess amniotic fluid levels if you go past your due date.
But Kat, can I just, there are other, while you may consider your pregnancy uncomplicated, there are indications for testing. So for a mother who is significantly older, in some cases for people who are significantly overweight, there are some indications where your pregnancy might be perfectly fine in your mind, but there are some indications. So I would just make sure you have that conversation with your physician or midwife as to why you're having that testing done.
Yes, good point.
All right, well, we are now at 8:03, so our time is up. I would like to say thank you to all of our panelists. This has been really very helpful. We are so appreciative for all of our patients who have submitted questions. It is our goal to be able to answer these questions for you, to try to relieve as much stress as possible. We know that this is it's a stressful time, not only, having your baby and being pregnant, but also dealing with the social isolation that's going on. And so we want you to know that we're here for you, that you please feel free. There are patients that have reached out for some questions that weren't answered. We will continue to do our best to look through the questions that have been posed and work to try to reach out to you to answer those questions. Earlier, the previous town hall did come up. That town hall is recorded and can be found on our website at ynhh.org. So if you'd like to take a look at that, that does speak to a lot of the questions some that have been posed tonight, but was much discussion about COVID, the COVID unit, the PPE that is worn, is not worn, some of the visitation questions. So we would encourage you to take a look at that to try to really help you understand some of the processes. And I think what I'd want to end by saying is that we are continuing to do our best to evaluate the changes in practice, to watch the research closely. We are working to provide evidence-based care to each and every one of you. We want you to have an amazing birth experience. We want this to be special for you. We know that this is causing and shifting the way that, you know, we provide practice, and the changes to the visitors and who can be present with you, and even who can be with you once you go home, that these are all stressful situations. So we want to be able to continue to support you, and we will continue to look to the evidence and to the research to make changes to all of the things that we've spoken about. So just because today this is the one protocol, it doesn't mean that we won't modify that or change that as we learn more. So we just want you to know that we will continue to do our best for you, and we wish you much luck throughout the rest of your pregnancy. And as you move towards the birth, we will be here for you, and we will welcome you, and we will make this a joyful experience for you and for your family. So have a wonderful night, everyone. Thank you so much for joining us, and thank you to the
Katie.
panel as well. Thank you.
Thank you for hosting us.
No problem. Well, you're welcome back anytime.